This is Chew on Health, and I'm your host, Dr. Joe Chew, and I get to interview health experts in various fields to answer your most burning health-related questions. To submit yours, simply go to chewonhealth@gmail.com, and that is spelled CHIU on health@gmail.com. Let's get straight to today's question. Okay, so we have back with us Dr. Vitaly Mozeson. Doc, thank you again for being on.
Thanks for having me.
Absolutely. So another question that we have directed for you is, so a listener wants to know, can and how does diet affect low back pain?
Yeah, no, that's a good question. Yeah, diet and lifestyle in general has a huge effect on back pain and the condition of your discs. Your discs are 86% water, so first and foremost, people that are dehydrated are more prone to getting disc injuries. So whenever people undergo our disc restoration therapy method, I'm always having them drink at least 1/3 to, just a little bit more than they usually drink, sometimes twice as much if I realize that they're very, dehydrated. Another thing that affects back pain is stuff like smoking. When you smoke, you're cutting off the disc issue. So I always see smokers having horrible back pain, and as soon as you take an X-ray, their backs are aged at least 10 to 20 years older than they actually are. So smoking has a negative effect on it. You want to stay hydrated. Your discs will respond great to that.
Let me back you up. Let me back you up just a little bit. You cut off just a little bit. I think we had an interruption in signal. But when you were first talking about the negative impacts of smoking, you mentioned that it cuts off and then...
It cuts off oxygen.
Got it.
Smoking cuts off oxygen to your soft tissues, and that's kind of common sense. But being that your spinal disc is a soft tissue, when you do have a smoker come in, their backs are always aged. So you got to make sure that you're getting plenty of oxygen, plenty of good fresh air, and make sure you're doing some cardio. It actually affects the condition of your tissue. You give your tissues oxygen, essentially.
Okay. And I would assume, too, that if one has let's say a poor diet, then they're going to be prone to weight gain and thus more pressure on their back.
You nailed it. Absolutely. I mean, even 20 additional pounds could put tremendous pain, or tremendous pressure rather, on the disc. So along with our program, we always address weight. Weight is a huge issue, and weight could literally be the difference in how effective this treatment is going to be. Okay.
And this is kind of for my own knowledge. I wanted to ask you, do you also incorporate, would you also advise some patients of yours on some of the more inflammatory foods, such as processed foods, bad oils, things like that, to stay away from that, as it can be inflammatory in the body, and maybe throw in some greens, some healthy herbs that are anti-inflammatory. Is that something that you help your patients through?
Absolutely. And I mean, as yourself, being a functional medicine practitioner, you know which foods are inflammatory, which foods could actually age your tissues more. And yeah, processed foods, foods that are low in antioxidants, you want to actually do some research and speak to guys like yourself. And we guide people down that path. And we do have a general approach and a system of eating the right way to make sure that your tissues are healthy. But absolutely, food makes a huge, huge difference. So it's not just what you do physically, it's what you put into your body that can affect the health of a disc.
Excellent. And I think this is the type of stuff that really people need to know. And so thanks for sharing that. And if you guys have any more questions about that, you can reach Dr. Vitaly at drtmethod.com. Thanks, Doc.
Thanks, Joe.
You bet. Thank you for listening to Chew on Health. To get your question answered, email us at chewonhealth@gmail.com. And to find out more about our health expert, go to the show notes, or you can visit us at chewonhealth.com. And until next time, cheers to your health and wellness.